All right, so as typical fashion, there's something going on with the link into Facebook, going Facebook Live. So it is live on YouTube, and I'm recording, but I'll have to kind of share the YouTube video on Facebook later. So we won't have the same Facebook Live interaction, but it just happens, do it last week and it works, and then this week something changes. So, all right, so you guys ready? All right, here we go in 3, 2, 1. What's up, y'all? Welcome to the Sports Medicine Broadcast, a podcast to promote and improve your practice as an athletic trainer. This week I have Paul Savage and Justin Gardner as we're discussing topicals and wound care. I am Jeremy Jackson, and I got my assistant Sophia Amata, and I also might be joined by my principal and associate superintendent for campus development. They may be joining us as part of the conversation as well. But Justin is with Active Skin Repair. So BLDG Active is a skin repair product that we're going to be kind of discussing some of that I learned about at NATA. And then Paul has 17 years as an athletic trainer working with a San Diego-based high school setting, 10 years professional indoor soccer, 5 of indoor football, plus 6 years extreme sports with the X Games skateboarding. Graduated from Cal State Fullerton with a bachelor's in kinesiology and continued on to get his master's at Concordia University. So Justin has 15 years experience in the wound care industry, working with lots of different wound care products. And so again, he's going to be adding his experience and expertise with the wound care as well. This is sportsmedicinebroadcast.com/wound care. Again, sportsmedicinebroadcast.com/wound care. So you can follow right along there. All right, so let's get started. I just recently asked on Facebook in the secondary schools athletic trainer group what some of your wound care tips and tricks are, or some of the myths that we think need to be busted. And so there was somewhere around like 150 different comments, and some of them obviously repeating because that's how Facebook works. But Paul, let's start off with you. What's your go-to product? What's your best tip or trick for wound care? All right, so Justin, why don't you tell us a little bit? He mentioned active and pH fuel. So tell us a little bit about active skin repair and why you think that's Paul's go-to. Paul, you mentioned the hydrogen peroxide being an issue. So talk a little bit about that, and then Justin will come back to where you're talking about the cytotoxic stuff. So Paul, go ahead. Justin? Go ahead. We were talking about peroxide, cytotoxic, and that.
Yeah, so I think active skin repair does a lot of things to replace the toxic products. It also doesn't use synthetic antibiotics, so unlike triple antibiotics that often get used as well, there's no allergic reaction to active skin repair. You're not going to take that risk of having any type of allergic reaction to a synthetic antibiotic. So not only can you replace the toxic things like alcohol peroxide betadine that have cytotoxicity and kill those healthy cells, you can also use something that doesn't have any allergic reaction to it. So I think that's important as well.
All right, so that's one of the other big questions there. We mentioned the triple antibiotic. So something that new that I learned out of that discussion that I had on Facebook there was the use of triple antibiotics and the role that they may have in harming the wound and not allowing it to heal like it should, but then also in creating more of the methicillin-resistant staphylococcus, or like the resistant strains of bacteria. So, why don't you guys tell me a little bit more about how that works?
I know the application of, like when you're talking about like cover or not to cover, or keep damp or not damp, when you use like a triple antibiotic or anything like that, you're keeping it moist, but what are you putting into the wound to keep stuff into the wound that it can, like you were saying, get an allergic reaction, put something into it. So you never know what you're really putting in from those oils, lotions, and different things into the wound when you're keeping it wet. So it's hard when you're putting a product in like that. What is it going to do to the wound? Is it really speeding it up? Is it actually hurting the wound? It's tough with all those different products I saw in the discussion board.
Yep, and I'll add to that as well, Jimmy, is that you, with triple antibiotics, it's actually, they were invented in 1950, so it's a pretty old technology. And what I think a lot of healthcare practitioners have learned is that it's not usually the best, it's become a common one, but not the best method to really deal with skin repair issues, open wounds. So just because of the length and because of some of the marketing power around these triple antibiotics, it becomes go-to products. But if you look at the science around the use of them, there's a lot of good new evidence that suggests moving away from them.
All right, so again, just kind of continue on that same thing. Why? What are some of the evidence saying? Why are we suggesting to move away from them?
Two big ones that you touched on and I was talking about at the beginning. One is allergic reactions. So up to 25% of patients have allergic reactions to the antibiotics used in the typical triple antibiotics like Neosporin. So high allergic reaction, and they can also create antibiotic resistance. And the petroleum-based oftentimes can create own issues of spreading bacteria as well. So those would be the main reasons that come to mind.
All right, and then I think we kind of mentioned earlier, like keeping it dry versus, or keeping it moist versus allowing it to dry out. Let's talk just a little bit about that because obviously I hear both sides of the story, and then also talk a little bit about culture because Paul, you're working with soccer, with indoor soccer, right? And a lot of soccer populations, especially down there, San Diego, you're close to Mexico, and down over here in Pasadena, we're close to Mexico. So, talk some about some of the cultural experience with wound care as well. But let's first address the keeping it moist versus allowing it to dry out.
I think keeping it moist or like drying out is like preference, depending on the athlete, depending on the situation. I normally like to dry them out, other than for scarring. More of a something I keep my athletes that want really worried about scarring or anything. I'll keep it a little bit damper over a period of time. But for most of my athletes, it's drying it out. Minus using the initial, like we use an active gel on it. cultural aspect of that is you'll see like Hispanic, they don't really, they put whatever they have, whatever's playing with the water, like they'll wrap whatever on. There is no like best care practice. There's no standards. It's wipe it off and let me go play. Um, so they're really, I think, maybe behind in that in the culture aspect of it. And I think it's also resources what they have available. They just go out there, they'll take pre-wrap, wrap around a few times, and say, okay, keep playing. They're not really picky on what they do. They just cover it up and go. So it's tough. I think you need to kind of give them resources and give them, let them know what best practices are, and try to teach them. That's one of the nice things when I travel down to down into Mexico from the cities is bringing products with me and teaching their staff and showing them and getting them to use it. And they're very grateful and they enjoy getting the free samples and products and learning how to use the products. You can see it over the years going back to these cities that it's kind of taking on with those teams.
All right. So what about some of the other cultures that you may be dealing with in soccer? You know, because if we're talking about Hispanics, because for you and I, that's a large population, but other people listening may have a different population.
Yes. So, like, in 2 weeks, I'm going to Australia for the U.S. national team indoor. So, we're playing Brazil, Argentina, South Africa. So, I've done this once before. So, I'll get a chance to see them and talk to them while I'm there and see what they do. But we have players from Brazil, from um, different parts of the country, Europe. But you'll see that I haven't dealt with Europe as much as more like South American, like Brazil. And they're pretty much staying at the water, covered up in whatever they have, like loose bandage or pre-wrap or bandage. They're not really too concerned about it. They just leave it open. They're like, oh, I'm cut, I'm bleeding, and it is what it is. And you'll see them get infections. You'll see them get take twice or 3 times as long to heal because they're not used to it. So that's one of the things when I get these players from internationally is teaching them how to take care of it because they might be going home. They might play in our games and they might be going back down to CJ for 2 or 3 days before I see them again. So making sure I give them the products they need and teaching them how to keep it clean and what they need to do over the next 24, 48 hours. So it's a teaching method to get those players to know they have to do this before they get an infection because I don't want to come back in 48 hours and dealing with an infection and having to deal with that for our game next week. So it's a lot of teaching the international players like what we do, how we do it, why we do it,
You kind of dropped out for a second there, but you're saying basically it's a lot of education as well. So
it's educating the international players because they don't have anything on their team. They just throw whatever they can on it to cover it up. So they'll throw a Proxo and on it, they put one on it, wrap something on it, and say, oh, they get the effects up. It's tough. It'll scab up and it is what it is. We try to keep it from getting infected. But there's better ways to do it than just throwing water on it and wrap it up with whatever you have.
all right, so Justin, looking at the 15 years experience with wound care and the hospital and hospital products, what have you found is the norm there? Do the doctors, physicians, nurses, do they tend um, to cover it up, to close it up, to wash it out daily? What's the norm there?
Yep. I think it's in the setting and the care of that patient, whether they're going to be an elderly patient with vascularity issues or whether they're a more active patient who's going to be playing sports. So you find it varies. And with active skin repair, we have both a spray, which is a liquid formulation, and a hydrogel, which is that clinician or that athlete that option to use whatever they feel is best for that situation. So the hydrogel is going to provide that moisturization, typical to what you might find in a petroleum-based topical antibiotic, but without the petroleum. So it uses a medical grade hydrogel, which is a really nice way to provide moisture. Where the liquid doesn't have that gel base, so it just applies on. You can dry the wound, and depending on the need to either wrap it up or allow it to stay free to air. And again, it's highly dependent on the specific nature of the wound and what the skin damage is. Um,
All right.
But I guess to add one more thing to that too, Jeremy, is when you in the hospital side when you see that, I think a lot of what we learned about wounds especially as they become infected or chronic is how important it is to immediately apply an antimicrobial, whatever that antimicrobial is, whether it's active skin repair or another type of antimicrobial, as quickly as possible to reduce that chance of infection. And it's an easy and low cost thing to do to potentially avoid what can be a costly and a long recovery process from a staph infection or any type of other infection.
All right, so let's go through that real quick. Antimicrobial, like, in saying that, can you kind of clarify what that is?
So antimicrobial will be the ability to kill a host of different bacteria, including complex bacteria like staph and mercury.
And so to me, if I heard antimicrobial, then I'm thinking Neosporin because that's what I've always known growing up, right? And so you said it's important to apply that right away, but then we also talked about using Neosporin where up to 25% have an allergic reaction, and it also increases those MRSA. So what are some other options there? Obviously we're talking about active skin repair as a antimicrobial because it has the hypochloric acid. We'll cover that in just a little bit, but what are some of the other options for an antimicrobial?
Paul, I'll let you answer that.
Another product I've seen, I've used Topicals in the past, and used Fuel. I mean, they make each, like, Kramer and Mueller will have their own, like, napkin or, basically soap in a can. So every company has a product like this, but it's just the effectiveness of that product. As I've gone away from, like, the mobile nitrogen or the spray can stuff to where with the Topicals, that product was great, and I stopped using Fuel. That product was really good. But once I tried active, I haven't worked with any of those products. Just because coming in the cheap ones with spray as well, that spray instantly on it is able to get them. I spray it, I know it's clean, I can work, do whatever I need to do to get it back in the game and cover it. And then once they get out of the shower, use Eggshell for a 24-hour period, and then I don't have to worry about this stuff. We haven't had a problem in the 2 years that I've done this product now.
And a couple other too that will go in there is silvers often can work as an antimicrobial as well, and so you can get silver-based dressings that work as antimicrobial dressings, and you can actually use that conjunctively with something like an active skin repair. So you can also get antimicrobial dressings again with silver in them that can help reduce that infection chance as well. Antimicrobial being anything that it kills bacteria, so I would also say there's different ways to look at the benefits of each antimicrobial and whether one has cytotoxicity. But if it kills bacteria, it's probably better to make sure that you kill the bacteria and reduce the infection, even if that comes as a consequence of killing the cells. Now, what's great is there's antimicrobials out there like active and other antimicrobials like silver that don't have cytotoxicity to them, so they allow you to both provide an antimicrobial without killing healthy cells.
All right, so we're ideally, as healthcare providers, we're looking for an antimicrobial that is not killing cells. So using like active skin repair. And tell me again, it's hypochlorous?
Hypochlorous acid is the active ingredient.
Okay. So you're looking for hypochlorous acid. Again, active skin repair has that. And one of the issues that we were talking about is that until just this year or last year or something, just recently, that this product was only available in the hospitals because it was not shelf stable for more than, I think, 90 minutes or something like that. And so, a new technology came out to allow this to be shelf stable for about 2 years. So tell me a little bit more about that and the change in that, Justin.
And there's different hypochlorises out there available. And it was probably around 10 years ago that the stability has really taken an advancement. And that's where hypochlorous now is much more widely available, is the ability to stabilize the molecule shelf life with 2 years. So it's stable up to 2 years. And what it also allows you to do is every lot that we produce, we're able to test it. So we produce the product and then we test it to make sure it kills all the strains of bacteria that are necessary to make it that antimicrobial before it's released. And then we can also test it for that cytotoxicity, make sure that there's no toxicity to it. So it provides a highly stable and effective product that we know is going to work.
All right, very good. So again, we got a basic kind of understanding there of how active skin repair works, and the fact that it doesn't kill the good tissue, which is what we're looking for, and then it also promotes the healing in the way that the body does. You mentioned silver is a antimicrobial as well, and is that work more or less the same way?
Okay, they're different modalities and different products, so they're both going to work a little bit differently, but silvers do have the ability to kill bacteria and work as an antimicrobial as well. So you'll find different silver products out there that use quite a bit in the hospital space as well. So we find that oftentimes they get used conjunctively, that you might use a silver-based dressing. So there's some really good dressings out there that use silver that help, again, with that bacterial load or bacteria reduction in that wound. So you could use something like Active to make sure you clean, irrigate that wound, and then put a silver dressing on it that works as an antimicrobial dressing.
Okay, so I got a whole list of things here from comments and people. So we're going to kind of walk through some of those and just address those either from the wound care side in your expertise, Justin or Paul or myself or even Sophia. She's over there typing up notes for us. Just expertise in wound care or your experience. One of the things that has been like a old school mainstay is Nitrotan. Do you know about Nitrotan, Justin?
I'm not familiar with it now.
Paul?
When I took over the high school 17 years ago, the staff of it, I tried it for the first time. I'd never seen it before. Used it a couple times, but I never really had really kind of like used it. It wasn't doing it for me, and it wasn't my go-to product. I never really used it after that. I mean, it is effective, but I think some side effects.
Yeah, so pretty much every comment with Nitrotan was like, I used to love that stuff, but it burned, right? And so I think if the product you have is going to prevent people from coming to you for wound care, they're like, oh, well, not every time you put that stuff on me, it burns. Well, even if it does work, when we were talking about like cramping science and the podcast with hydration, they're like, you can have all the cramping science technology you want, but if they don't drink it or ingest it, then it doesn't do any good at all. So it's kind of the same thing with these topicals. We want to find something that works and doesn't hurt. So one of the things, go ahead.
That's the first thing. So from an athlete or someone in the city, you try to put something on it, it's gonna burn. It's gonna hurt. So every athlete's like, "Are you putting this on me? It's gonna hurt. It's gonna burn." That's their automatic response is when you try to put something on. That's their experience.
And to add to that, so one of the things that's unique about active skin repair, because it's not toxic, is you get no sting to it. In fact, it takes a little while to train people that that's okay, that it's still working, that the molecule is still doing its job, even though you don't feel that sting. And it looks like Nitrotan, when I looked it up real quick, is an alcohol-based product. So it makes sense that it's going to kill that bacteria, but it's going to come with that highly cytotoxic sting that's also killing those healthy cells.
And so that's another thing that I believe we should all know, but just like Paul was saying, that there is still people using peroxide all the time for everything. Alcohol should never be used on an open wound. It's great for cleaning off a table, cleaning off scissors, something like that, or cleaning the skin before you put on some KT tape or whatever it is. But it only kills living stuff. It doesn't have the benefit of peroxide where it kind of bubbles it up, helps clean it out. So if you're still using alcohol to clean wounds, then you really need to look at why, rethink, and then find something else that'll work for the wound care and the health of your patients. So anything else about alcohol, guys?
Don't use it except for cleaning, like you said. You only use alcohol prep pads for like the clean rate for KCP, that safety method. So I try to hide those bottles in my area because I don't want someone walking in with a scab and using it when I'm not there. They might not know. So I keep those products away so they don't get their hands on them so that doesn't happen.
All right, so along the same lines, we're talking about Nitrotan hurting, using a hurt-free wash. So there's the Band-Aid antiseptic hurt-free wash. Um, it's not supposed to hurt, so it's, you're spraying it. It's the antiseptic. You guys ever use that little blue bottle of Band-Aid hurt-free antiseptic wash?
No, I haven't. Can't say
I have not as either.
All right. So again, that's a popular product, and I didn't look up what was in it. I think most athletic trainers know about it; they've seen it, but again, I'm not exactly sure what all's in it or if it's cytotoxic at all. I don't think it's alcohol based because it's supposed to be hurt free and doesn't cause a stinging and the burning. All right. One of the other things for washing, most people said soap and water, or some people said saline wash. Some people said sterile water. So, Paul, Justin, address those three types of washes, like the saline, the sterile water, the tap water, the soap and water.
well, I think when I was reading the article, like, or reading from in the comments, is in our kits or in the training room or in the facility, use more of a wound wash, sterile saline solution, where it helps you clean it out. It's great. It helps you get debris out. You can do that. Or if you don't have a bottle of wound wash, you don't have that influence from soap and water to doing that. I know some were saying like, oh, be careful of tap water, because I mean some tap water can be contaminated or dirty or not the best product. It's easy like dealing with depending on what area you live in. So some tap water can be pretty contaminated. Sterile water or wound wash, I think sterile. So depending on knowing your area, if you live in an area that does not have good tap water, then you know not to use that. But for the most part, soap and water, saline, and wound wash, anything like that, put on it right away and clean the first thing. You're not getting that anti product in there also. So that's missing out, but at least you're getting it clean quickly before you put some kind of product into it.
Justin?
Yeah, and I would just echo what Paul was saying. I think I know cost is always an issue, so you can use things like hypochlorous acid or active skin repair as a wound irritant, but it's not going to be the most cost-effective way of doing that. So using sterilized water can often be a great way to make sure that you provide irrigation to that wound, you get it clean from debris, and then apply a topical antimicrobial. And I would say one thing to do, and a great resource for anybody kind of researching products, is to look at the active ingredients, to go online, and PubMed provides a great resource to go do a little bit of research on what those ingredients are, how they're used, and what they're able to do. And depending on your setting and what you're trying to address, is does it kill complex bacteria? Is it going to be able to address some of the issues that your players or your patients are going to potentially have? And so, again, PubMed's a great way to kind of do a little bit of that research as well on those active ingredients.
All right, so kind of a little bit of a diversion from what we have been is getting the athletes to not put their hand, or say they got a bloody elbow, putting their elbow right up against a water bottle or right up against the sprayer nozzle. Because I'm like, do you not realize that you're spraying blood everywhere, that now that nozzle or that water bottle we can't use or has got to be disinfected? And again, we're talking about tap water, but like, how do we keep them from making the sink all bloody, or getting the shower all contaminated or whatever it is? So I don't know. I mean, we're talking about tap water, but sometimes that may not be the best as it is.
True, you want to make sure it's in a method that's not destroying the cure master when you got that whole area to clean up. It's like you turn a nosebleed into a whole crime scene sometimes, where one elbow wound will have you bleed all over the court, and you're spending 15 minutes cleaning up blood before you can continue the game. So you just got to make sure. Normally, it's getting them some cover, like
So it is universal. It's not just my school here, my kids. So
No, you'll see the trail of blood coming from the uniform sometimes. But there's a blood trail left.
okay. Here on my list, I have Neosporin. We kind of already covered that, but one of the comments there was use a Polysporin or a Bacitracin. And so, thoughts on those other topicals that we commonly use, but we may have used just because somebody else used, like you said about the peroxide. So, the other type of topical ointments like Polysporin or Bacitracin.
You'll see a lot of people use the Neosporin, the antibiotics, but not too used to it, accustomed to using. What I know they like that because it kind of helps be a thick layer on a wound or something. What we normally do is if we get a wound covered up quickly with Vaseline, just like sterile Vaseline will normally be a good barrier real quick to cover it, even if we've been playing, especially in like the soccer games. We're playing on a hard turf, so the knees get cut up all the time. So proactively now we'll use some Vaseline and leave up so we don't get cut up as much. But a lot of the guys, if they get to it or it's rubbed off or whatever, will have this open turf burn, and we'll use a Vaseline just to cover it, keep them playing, get them going, and then we'll sterilize it and do everything after the fact. But it's a good barrier just to get us through today.
So with the Vaseline, does that in any way, I guess, break rules? Because like with pine tar or whatever on baseballs, that kind of thing. Because it seems like if you're gonna hit the ball with your knee, but now you have Vaseline on it, does it change anything?
You're not, no official's gonna notice it's on there. There's no like set rules saying you can't do that. It's not like a pine tar, but it's a thin layer. Normally you're not gonna, cover up with most of the blood. So the only reason when you get them off the field, you see the blood coming off of them. So if we can get a thin layer of Vaseline right over it, it'll kind of keep it covered. I even use it in football, especially anytime you have a quarterback with elbow injury, you usually need to stay active. You can't just put a band-aid with power flex, just like cover up on it. We'll just cover it with Vaseline and give it a coating of that and get going. And I haven't had a ref ever say anything to me about that. But just the best method of just covering up quickly, getting them back out on the field, and dealing with any skin shakes.
I gotcha. So real quick, I just had my principal, Laura Gomez, and our associate superintendent walk in. So I don't know if you guys want to. You can walk over here. It's okay for you guys if you want to see because they're on video call. So if you see them walking behind me, or if you guys want to come sit here for a few minutes, you can do that as well. And so they're just kind of checking out what we're doing here live. Hop in there. So. All right, so we're going to go to some of the Facebook stuff that we were talking about. Chris Trobaugh was talking about centricides and nitrotan. Mark Phillips said soap and water, and then he also mentioned the hypochlorous acid. One of my favorite comments that I saw on there was definitely eggshell. Now, so I'm going to read this. So that you guys know I'm not just making this up. But Molly Quigley said she's used the lining of an eggshell to help seal a wound, and it worked pretty well. And then she sent me the article, so I'll have that link there in the show notes. But it says, so she had an athlete bite his lip during a basketball warm-up and tried everything to get the bleeding to stop. But after a whole quarter, the ref kept sending him out. So she had run out of ideas and remembered reading, it was like in a wilderness magazine, about using the lining of an eggshell, specifically the little gross white lining you can see when you crack a raw egg and how it can help to seal a clot wound. So she was desperate and stole an egg from culinary and cleaned it really well and got a tiny piece of lining and put it over the wound. And then, so it says we gave it about a minute to dry and actually formed an almost dry layer of skin that totally stopped the bleeding. And they pulled it after the game and it was fine and could barely see a mark and left it clean. All right, so Paul, in dealing with the wounds, Justin, in dealing with the wounds, what are some of the really unique things that you've seen?
I've seen people try to cover with clean and get their hands around whatever they have available, but I've never, until reading that story, I've never heard about the egg experience. So that's a new one to me for sure.
Justin, you ever heard that one?
I've never heard the egg one, and I've been in the space a while, so I've heard a lot of them. You hear people use super glue a lot, and my caution to that one is it obviously will work. It will seal it, but you have a high chance of sealing in bacteria. So whenever you use something to seal a wound, it is so important that you've created a sterile wound environment. That you've used something to make sure that that's clean. And there's a lot better product out there than super glue. One that we've been working with lately, and we have a good relationship with a company called Zip Stitch, and they've actually created a more modern way to, and they'll sell it on Amazon, and it's available to consumers now. Same kind of basis that came out of surgery is it provides that ability to quickly close a wound similar to a stitch without actually having to use needle and thread, but it uses a more modern approach. It's not invasive.
So is that zip switch like zipper or dip?
Zip, like ZIP, stitch.
Zip stitch? All right. So I haven't seen that. I'll have to check that out as well.
That's a great product actually. I've seen that. I demoed it when it was coming out a couple years ago, and I demoed the product, and I was kind of like, yeah, whatever, and like kind of gave it the nonchalant laugh, and then after you practice using it, it was amazing to see how well that product works. It's basically just like it's like having zip ties and put it like a bandage, put it on, and zip it, make it, cut it as long as you need it to do, and it just seals it right up, and it's like stereo strips on steroids. It doesn't have to worry about it coming off. It automatically will seal it, and you have a nice tight fit, and it was a really good product.
So as we were kind of continuing on with that same topic there, so what are your thoughts on cleaning out the wound with like active skin repair and then putting the steri strips on? Is that one layer of the hydrogel from active skin repair enough to clean out the wound, or do I need to like wash it a couple times with the spray and then put the gel on and then put the steri strips on?
In my practice application, I would normally spray on it, and I'll spray pretty vigorously and get in there and maybe use a cotton tip to make sure I kind of cleaned it with it and got everything out of it with just the spray. And then normally I try to dry it, get it as dry as possible before I put the strips on. Once I think it's clean and it's gotten in there, I won't put any gel on it. If it's a thick, deep cut, I want it as dry as possible before I put the strips on. Now, if it's just superficial, like burn or turf burn or something like that, then I'll put the gel on and pack it and let that just heal over 24 hours later.
And Jeremy, a lot of times what I've seen in hospital settings is they'll actually soak the dressing in hypochlorous acid as well. So soak the dressing in acid, get it really wet with the acid spray, and then wrap it around the patient as well.
So using that to soak and help clean the wound, but obviously like steri strips, yeah, we want the area dry. So just recently my son, and he fell and his arm went up and hit his glasses cut his eyelid, and so he's kind of riding home with a bandage or a gauze or whatever it is, a washcloth over his eye. So I get him home and I use the active stuff and put it on the cut and then dry it off around the outside, use the glue and then the steri strips. And so it's healed up pretty nicely. I just want to make sure that like if I'm using that product, that I'm using it the best way possible. So, all right, let's continue on here. Have you ever guys ever used honey on a wound?
No, I read that also.
Yeah, so I've seen it used quite a bit. It's Manuka honey, and it's a medical grade honey.
Thank you.
There's one in the hospital that's used quite a bit called Medi honey. And it actually is a fantastic antimicrobial, in my opinion, as well. So I think it's quite a good product. And again, you need to make sure it's a medical grade honey that has proven efficacy as being an antimicrobial. But yeah, surprisingly, it's quite good.
All right, so
get a lot of clinicians use it and enjoy it and really like it as well.
So that was Tanya Watson mentioned Meta Honey, and I think that's what you just said there was Meta Honey. So it's made for that, and then also she mentioned using laser for activating the healing of wounds. So have you guys used a laser for wound care at all?
Well, if you go to like the cosmetic world, they use lights and lasers to do that. So you can use the same thing, like type applications on the wounds, and it does speed up the healing if you have the proper, if you know what you're doing with it, you can speed up the healing with a laser or light.
Justin, experience with lasers?
Yep, you see it used quite a bit in the dermatology space. I haven't seen it in the sports space or in the hospital space too much, more in the outpatient dermatology side.
All right. So one of the other questions I had, or I saw a bunch of people mention, was skin integrity. Skin integrity. Have you guys had experience with that at all?
No, I read that also. I was gonna look it up, but I have not seen that product. It's hard because normally once I find a product, it's tough for me to go away from that I've been using. But I'm sure I'd have to look into it. I haven't seen it.
Right.
Yeah, and I'm pretty sure what skin integrity is just a hydrogel. So it's a medical grade hydrogel. So for active skin repair, the gel, we're using a hydrogel as well. We just have that. We're able to stabilize the molecule hypochlorous acid inside the hydrogel. So you're getting a hydrogel with hypochlorous acid. So skin integrity seems to be just a hydrogel.
So I had, again,
A great alternative or great product to help bring moisture to the wound. You get hydrogels used all the time, and again, a part of one of our products is a hydrogel.
so there I had Melissa Harrington, Linda Torres-Gregg, Carrie Ann Sear, all mentioning skin integrity. There maybe had some more, but just trying to mention the people who kind of contributed to the conversation there. So Whitney Catalano said she one time grabbed a Isoquin instead of a wound wash. So that's definitely something, Isoquin's typically yellow, but I guess if you have it in a color bottle, you might not know, or you're trying to clean something quickly. So again, one of the benefits of having something like active skin repair is that it doesn't sting. It can be used for cleaning, for moisture, and it also does all of the good and apparently none of the bad of these various products. And so if you don't want to have Whitney's experience of spraying something on there that really hurts and makes a kid jerk or sling that blood across the training room as they're shaking it off kind of thing, then you can definitely check out active skin repair. So then we have Tess. She said that she was working at a dog, a kennel, a wound thing, whatever it was. And so she'd been bit, and she's used hydrogen peroxide successfully. But again, that was a couple years ago, and just may not have known any better, done anything different. But again, let me circle back to the letting a wound dry up. Justin, what do you feel like in the hospital that they're going to do for like an abrasion and then maybe laceration? How are they going to kind of treat those different?
Yeah, well, you'll see it there in debate. I go to quite a bit of wound conferences on the professional side, and you actually see that debated quite a bit. The standard of care, when you see a lot of products compared to what the current standard of care is wet to dry dressing. So that's kind of been what has been accepted as a standard of care within the hospital space. That you, again, depending on the severity, depending on if there's chronicity to the wound, you'll get a lot of varied opinions from the clinical side.
So even the experts are still unclear on letting it dry out or one versus another. And so one of the big things that like Paul mentioned was getting a scab or letting a scab over. And so then those continue to rip and continue to bleed a lot. And so I really wanted to see if there is a best way. Like if I keep it, if I spray it off with water, we put that Vaseline on, that stops the bleeding there. And so then we have them soap and water once they get to the locker room, and then we spray that active on there and then keep it covered. Is that going to give them the best chance of it healing without a scab, without reopening? Because, with any sport, they're going to practice multiple times a week, and covering up the wound every single time. Or like you said, any other thoughts there? Any other tips?
Like I had this happen yesterday. Female soccer player who fell on the training episode had old, and it was scabbing over, but it was infected, and I was able to just basically clean it with the active spray. Just by spraying on, you can see I can just with the cotton tip pull all the infection out and get it clean. And once I did that, then I'm just gonna let that keep airing out and let it go. And it was just within like 2 hours that I was with the patient, you already see the difference in the wound. And you don't normally have to keep covering it unless there's another incident where it opens back up. So if you can get it just clean that one time and start to scab, just leave it until there's another incident. I wouldn't cover a knee or an elbow or anything like that. Now, depending on the player, depending on the position and what they're doing, like if it's baseball and being on dirt or something like that, then I'll cover up something if I need to. But for most athletes, I'll just leave it until there's another incident and have to deal with it.
And Jeremy, I'm going to add to that. One of the good things about active skin repair or any non-toxic antimicrobial is you can use it continually, right? So when you're not killing those healthy cells, what you can do, and we see it a lot, especially on professional boards, is the medical team will give the athlete the bottle, and that way it can stay. You don't have to cover up the wound, but they can continually spray it on there. It helps reduce that risk of infection, but at the same time, every time you're spraying it on, you're not stalling that healing process, right? So you can continually spray, keep it clean, without stalling that healing process. So I think that's a big benefit of any non-cytotoxic product.
Yeah, that Justin brings that up. Um, all my the skateboarders I work with, they'll get especially the nice laceration or on their elbow. Well, those pads aren't the cleanest thing in the world, and skateboarders aren't very compliant on how to take care of their own wounds. But giving them a spray bottle and something to spray on has been very beneficial to them because that just gets them away from infections. They will just here spray this on, it'll clean it, they'll dab it, they'll let it scab up, but then they're not going to take a day off to let it scab heal. They're going to go every day. So it's like more of an ongoing process of just spraying with the active and keeping it clean and letting it scab up. They're not going to cover it. They're never doing it other than maybe soap and water and then putting on the spray that I say you have to use this every time it's open. But just an easy spray, you can put it on any time, like you said, it's not going to hurt anything.
And we get used in the professional surf tour, on the professional surf tour, and you notice that a lot with the professional surfers because they're going back into the water. So they're not going to cover that up with some type of Band-Aid going back into the water, but with the high bacterial count in water, so they'll get out every time, have that bottle, spray it down, especially with the instance of reef cuts and chance of infection with that.
All right, so we're going to kind of continue down the list of stuff I got here. Bactine is something that Perry Dennehy, Audrey Stanley, Hillary Klein, Bamer, they also said that they keep that regularly. Perry said he's been using it since 1975. He's a very experienced, great resource. He was also EMT. Again, that may be something that works for immediate wound care, numbing the pain kind of thing. Again, people talking about using Vaseline instead of an antibiotic because it helps the wound heal and helps prevent some of that the resistant strains of bacteria. So, and actually, Jason Carew said that the neomycin in triple antibiotic or Neosporin has shown to reduce granulation and delay healing. So definitely something you want to consider. Look into, understand it for yourself as an athletic trainer, why you're moving away from this product, not just because I said so or some random person on Facebook, but look into it. And Justin mentioned earlier, PubMed is a great way to look up the ingredients and kind of go from there, understanding what they do. Daniel Young mentioned oils, so using lavender oil for cuts, abrasions, or tea tree oil with lavender oil. He says he uses that for him. His wife had a burn. He had some cuts, or kids had cuts. So thoughts on using oils to help heal wounds?
For burns, there's a lot of burn products out there. I don't use like the holistic approach with just lavender oils and things like that. So I haven't had that experience using that.
Justin?
I've heard oil successfully used for scarring, scar reduction, where people feel that they work to help with scarring. I think it's always nice to have products manufactured in controlled environments where you know that the product was tested to work in a certain way. So I think they can be great. You just have to be careful on and where they're produced and make sure that the efficacy is there that you would expect out of them.
That's kind of my approach with oils too. Is if they work, fantastic, but it's like supplements. If it's not regulated, then it could be created in a tainted factory, and then your Olympic gold medal is now gone because you took the wrong supplement. So, all right. Shelby Jacobs said use zinc oxide, which is basically like diaper rash cream, so that helps keep the wound covered and moist. And one of the things that somebody said about Vaseline, I had a cut on the back of my leg. It was actually when we were in Las Vegas. So Justin had just given me some samples of the active skin repair. I was stepping out of a helicopter because I took my wife on a helicopter ride for her birthday because she was there with me in Las Vegas. And I scraped the back of my knee on the ledge of that helicopter. And so I had this like 2 or 3 inch long cut on the back of my leg. So where was I going with this? What was that? I got lost. Yeah, so I was treating the cut on the back of my leg with the skin repair, but with the active skin repair, and it was one of those things that just needed to be kept moist. Oh, that's what it was. And then I ended up going to one of those float tanks, and those are like salt water, and so I didn't cover up that wound in the back of my knee. And man, for like the 20, 30 minutes or whatever it is, that thing was just stinging and burning because of that salt getting in that cut. And so I wish I'd paid attention to this before, or put that Vaseline on or put the hydrogel on before getting in that wound, that float tank, because that really hurt. So, all right. So Michelle Moe was talking about antibacterial products, and Sherry Johnson again. She mentioned the monkey blood or the mercurochrome, which I don't think people really use anymore. But moving on to Israel Pena, he said that the NATA position statement, it says that tap water is just as effective as the sterile or saline washes. And so the tap water with soap is one of the best things. And again, kind of going along with what I've been saying, soap and water is great. Get that, and then you can rinse it out with the active skin repair to help continue the healing rather than in antibacterial type thing. So, all right. I covered most of what I had there on the Facebook comments. So Justin, tell us one more time, how does the active skin repair work?
Yep. So hypochlorous acid is actually the same molecule that your white blood cells produce. So if you were to get cut, scraped, burned, any type of skin damage, your body's natural immune response is to send white blood cells to that injury. Inside those white blood cells are neutrophils, and the neutrophils produce hypochlorous acid. And it's your body's natural defense mechanism to fight off bacteria. And so what they figured out how to do was how to replicate that molecule that your white blood cells are producing. And they do that actually through an electrolyzation process of salt water. So you're using natural ingredients. And it has the power to kill complex bacteria within 15 seconds of contact, but with none of the cytotoxicity to it like we've been talking about. So what's cool is it's natural ingredients. It actually has the same safety profile as saline solution, so it's safe to spray around your eyes, ears, mouth, sensitive areas. It's not going to sting, and it's regenerative in the sense that it's using the same molecule that your body produces, just replicated through that electrolyzation of salt water. The major advancements in hypochlorous acid over the last decade have been in the stabilization process. So being able to get it with a 2-year shelf life and a highly stabilized pH level with no cytotoxicity, but having that strong kill rate, and be able to bottle it up and now be able to put it on a shelf for 2 years and know that the product's going to work the same at day one as it does at 190 days in, and be able to have that mobility and able to easily throw it in a bag or bring it onto a field really makes that quite a unique product that a lot of people still just don't know about. So it's really just getting the awareness out there, letting people know that yes, soap and water works, and there's advancements to a lot of the antiseptics and that we have historically known over time, but there's advancement that makes it better.
All right, Paul.
So I think walking away from this or after the conversation, I think every practitioner or anyone, a parent or anyone doing this, like what do you walk away with is what are you doing for your wound care? How do you treat them? Or what? There's a lot of sayings, best practice, open or closed, dry or wet. But just evaluate what you're doing, and is there a better way? So you hear about those people. I've been using vaccines in '75. Well, there might be a better product in '75 that's come out since then that you might want to look into. So I think it's just reevaluating how you're doing it, why you're doing it, what are you putting on the wound, is it taking longer, is it killing everything, is there more scarring from it? Just reevaluating your position on how you're treating that. So soap and water, of course, easiest thing we can get our hands on, cheapest aspect you're gonna do, but what else? What's better than that? Soap and water might be like, okay, that's good, but what can we do on top of that to really keep the wound clean, keep the infection rate down, and help with scarring? So adding those three things onto the soap and water aspect, I think is where we really need to kind of get people looking into more than just, oh, I've used this product for 20 years, this is what I use. Getting the practitioner to really think about why they're using the product, and is that product really helping that athlete or that patient the best that we possibly can now? Because things have changed over these last couple of years, and I've even changed my way of doing it over every 2 or 3 years. I found a product that's better than the one I used before that, one better before that. So I always keep my eyes open and seeing if there's a newer, better product out there that'll help my athletes stay on the field longer, not get infections. So always staying up to date, going to conferences, finding a new product that's gonna really benefit our athletes.
All right, so this show is actually sponsored by BLDG Active, so the Active Skin Repair. So when I met Justin, I said, this is something I really want to talk about is topicals and wound care. And they said, okay, well, let's kind of do a show together. But he's also kind of partnered with Athletic Training Box. So Adam Larson has created Athletic Training Box, and it's a subscription box thing to where you can get different types of athletic training products that you would normally kind of hoard if you were going to an NATA convention and you just throw all these samples in your bag. And so he kind of has some stuff like that and some other different types of products through Athletic Training Box. And Active Skin Repair has been in that box a couple different times because I think it's a pretty popular item. So if you go to Athletic Training Box on Facebook, you can subscribe there, and you can use the code Sports Medicine Broadcast to save, I think it's 15% on your first order. And it'd be a great way to try out Active Skin Repair. So if you want to try it out, you can, hook up with Adam Larson and Athletic Training Box, or you can go to bldgactive.com and you can order some from there as well. So Paul, if somebody wants to get a hold of you, ask you maybe some more questions, your experience, things like that off air, then how are they going to do that?
My website or use my email address. You can use my paul.savage@smusd.org. It'll be my school website, so it should go through no problem. They can track me down through the high school, or you can call me directly or text me. It's 760-644-2420. That's my personal cell. If anyone has a question about any of the products or how I use stuff or experience I've done, I don't mind taking a call or a question. I know we've talked a lot about access today, but from all the products I've used over the last 15 years, it seems to be the best one that I found that it's our gold standard now. So that's why I've been talking so highly about it. But there are a lot of good products out there, so it's basically finding a product that you like that you can get your hands on and use. But I want people to learn that there's better products out there than maybe a hydrogen peroxide or a vaccine or a steam, things that they've been using for 15, 20 years. And we need to get that method of thinking out of get to the new age of what products are out there that really benefit our athletes.
Very good. Justin, someone who's going to get a hold of you, maybe the best way to get their hands on some Active Skin Repair?
Yep. Email is best, and it's just Justin, Justin, at bldgactive.com. And feel free, if anybody wants to trial the product, to shoot me an email. We're always happy to provide a sample or two to give it a try and work through you to make sure do you have access in a cost-efficient way to getting the product?
So you can email Justin, tell him, hey, I heard you on the sports medicine broadcast, and you said that you could give us a sample or two, and then that way he can get you out there, get your hands on it, and check it out for yourself, using it with your athletes. I kind of like it, and I like that I can spray it anywhere. So I had my son with the nosebleed, and I was like, all right, well, let's try this. So I put some of the little gel up there, wiped up his nose, and I was like, well, I mean, just said I could put it anywhere, so let's give it a shot. And the kids were like, yeah, let's just spray that stuff up there. Okay, all right, well, let's give it a shot. And it's better than them like being scared of me putting some on there. And so I don't know. I mean, I've been trying my best to use it since I got it, so I can have some real world experience. I don't have anything negative to say. So you can check out BLDG Active, or just look for Active Skin Repair. Email Justin or Paul if you have questions specifically. Again, this is sportsmedicinebroadcast.com/wound care. Again, this is sportsmedicinebroadcast.com/wound care. So I'll have a lot of the notes, the products, the links, the things that we mentioned in the show notes, so you can check those out, and also the ways to contact our guest today. So if you got any questions, for sure, email me or subscribe to Athletic Training Box. Get your hands on some Active Skin Repair, or email Justin, tell him you heard us on the Sports Medicine Broadcast and you want to check it out. So for Jeremy, Paul, Savage, and Justin Gardner, and then Sophia and my supervisors that came in today, that is a wrap. Thanks, guys.